Welcome to nerdsbazaar.com. Today our topic is pulmonary embolism. Definition: pulmonary embolism refers to the obstruction of the pulmonary artery or one of its branches by a thrombus or thrombi. So simply it's obstruction of the pulmonary artery. Risk factors: due to various reasons, your pulmonary artery may get blocked or obstructed. The first one is venous stasis, means slowing of blood flow in veins. What will be the reason for this venous stasis? Prolonged immobilization, prolonged periods of sitting or traveling, varicose vein, spinal cord injury. So because of these reasons, your venous flow may become slow. So there is chance for to get clot, and this clot further will lead or go to your pulmonary artery. The second reason is hypercoagulability, means increased coagulation of the blood due to release of tissue thromboplastin after injury or surgery. Mainly after injury, or if there is any surgery, there will be more release of tissue thromboplastin. This will cause hypercoagulability, or your blood will get coagulated easily. Example, if you have injury, tumor, or increased platelet count, in all these conditions you can see hypercoagulability of blood. So easily your blood get clotted, or thrombi will form, and this thrombi will go to pulmonary artery. Then venous endothelial disease, example thrombophlebitis, vascular disease. Then other reason is coagulation alterations and venous injuries, example heart disease, post-operative state or postpartum period, diabetes mellitus, COPD. So in these conditions, example heart disease, post-operative state and postpartum period. So in this stage there is more chance for this blood clot in your body. Other predisposing conditions: advanced age, obesity, pregnancy, and oral contraceptive use. Okay, this is one important point. Oral contraceptive use. Research shows that those who are using oral contraceptive use, there is a more chance for pulmonary embolism. History of previous thrombophlebitis, pulmonary embolism, constructive clothing. Constructive clothing means if people are those people who are using very tight clothes, very tight dreads. So what will happen? The venous flow will not be proper in their body, and later there is a chance to get blood clot. Example for this constructive cloth is jeans, leggings, etc. Pathophysiology. What is happening in pulmonary embolism? When thrombus or emboli enter pulmonary artery, the pulmonary artery pressure will increase. See, when your pulmonary artery get blocked, so automatically the blood flow or the pressure inside this pulmonary artery will increase. When pulmonary artery get blocked and its pressure increase, automatically your right ventricle workload will increase, because from right ventricle pulmonary artery is going to lung. So this pulmonary artery is blocked, automatically right ventricle workload will increase, and at last right ventricle will fail. Once the right ventricle will fail, there will not be enough cardiac output, enough blood supply to other parts of the body. Automatically your BP will go down, hypotension will be there, later there will be shock. Simple. Thrombus enter to pulmonary artery, then pulmonary artery get blocked, or because of this thrombus pulmonary artery pressure increase. When pulmonary artery pressure increase, automatically right ventricle will fail, because right ventricle and pulmonary artery are connected. So when right ventricle fail, hypotension, because when right ventricle, your heart right ventricle is not working, then the cardiac output will be very less, so automatically hypotension will be there. Because of hypotension, later it will lead to shock. Clinical feature: dyspnea is the most frequent symptom. There will be tachypnea, chest pain, anxiety, fever, tachycardia, apprehension, cough, diaphoresis, hemoptysis, syncope. But main feature is dyspnea. Management: what you have to do? there is emergency management. In emergency management, first we will give nasal oxygen, yes, because patient will suffer with dyspnea. Nasal oxygen, then intravenous infusion, because I told you that there will be hypotension and patient is going for shock, so you have to give intravenous infusion. Then if patient is having hypotension, it is treated by slow infusion of dobutamine. Okay, slow infusion of dobutamine. General management include thrombolytic therapy, example urokinase and streptokinase. Means thrombolytic therapy means you will break down the thrombus, that is thrombolytic therapy. You should refer the protocol and other procedure for thrombolytic therapy. Then anticoagulant therapy means heparin, warfarin, sodium, we will give these medicines as anticoagulant therapy. Then surgical embolectomy means surgically we will remove the embolus, that is surgical embolectomy. So these are the general management for pulmonary embolism. Thank you for watching this video. Please subscribe our video to get more and more